In this video today, I'm going to talk to you about whether you have celiac or gluten issues, or how to find out if you actually have celiac or not. Let's begin. So for those of you guys who are joining for the first time, my name is Dr. Samir Islam, and yes, I am a poop doctor. I am your poop guru. And my passion is to give you tips and tricks to help out with your gut health. If you're new to these video series, I would encourage you to subscribe down below. Every Tuesday around this time, I do a Facebook Live, and if there's any topics you want to hear about, make sure and comment down below. At any point in time during the video, click on the show notes where I have a lot of links about the things that I'm going to talk about. But in today's video, I'm going to talk about, number one, what are the typical symptoms of what's called celiac disease or gluten sensitivity? What are some of the non-GI symptoms of celiac? So celiac doesn't involve just the GI tract. A lot of things outside the GI tract that's involved. And then lastly, how do we actually diagnose celiac disease? If you're new to these video series on celiac, I'll have a link about what my other videos are concerning celiac disease. So let's talk about the symptoms. So a lot of people ask me, hey Dr. Islam, I think I may be allergic to gluten. I think I may have celiac. I think I may have a problem with my gut when it involves wheat issues. A lot of patients complain about a lot of GI symptoms when it comes to celiac disease, or maybe even what's called gluten sensitivity. This includes things like diarrhea. You have a lot of diarrhea, upset stomach. You have to go to the restroom very, very quickly, especially if you have food that's very rich in gluten or wheat products. You may also have constipation as well, or bloating. A lot of people come to see me because they're having bloating, and they think it may be due to a condition called celiac, or they're wondering if they are allergic to gluten as well. You also may have nausea, vomiting associated with that. And lastly, you can also have some stomach pains, or a lot of cramping, upset stomach. There's a pretty big range of symptoms when it comes to celiac disease or even gluten sensitivity, specifically in the GI tract. A lot of people focus on that, and they ask me about this because, hey, I'm your poop guru, and I can hopefully answer those questions for you. But beyond the GI tract, there's actually non-GI symptoms that can be associated with celiac or gluten issues. And a lot of people may not realize that they may be having some of the non-GI symptoms as their most predominant issue, as opposed to some of the GI tract issues. And some of those non-GI symptoms include a thing called anemia, or low blood count. A lot of people come to see me and their blood count is low. They don't understand why. They're not actually bleeding anywhere. They don't see any blood. They don't have any particular problems when it comes to blood. But they notice from their PCP that their blood count is very, very low, and they don't quite understand why that's the case. And so they may be finding out from their main doctor that their blood count is very, very low, and they don't quite understand why. They may be checking this on a routine blood test and see that their blood count is low. And celiac disease actually can be a very common symptom of that. And the reason we have this problem is that you're not able to absorb the iron inside the GI tract because your small intestine, which is the area where you have celiac, is not working correctly, so you don't absorb those particular nutrients. So you can have a deficiency of iron. A lot of people have also mouth sores in their mouth, maybe canker sores, or what are called aphthous ulcers, or ulcerations in the mouth. This can be a possible sign of celiac disease as well. For some people, especially if they're young, they actually may have more neurological issues like ADHD, maybe depression as well. And this can be a non-GI symptom of celiac, especially for those patients who are younger. Your liver enzymes may be elevated. You may be told you have inflammation of your liver, a hepatitis, or something like that. And one of the thoughts that could be causing that is also celiac disease as well. Joint pain and brain fog is a very common symptom of celiac. I have another video on how to make sure what the best diet is for brain fog. But brain fog actually may be a symptom of celiac disease or gluten issues as well. I have a lot of people tell me that they feel just fuzzy all the time. They can't think. They have a cloud over their mind, this brain fog that's over them. And this actually may be a symptom of celiac disease or a gluten issue as well. Like I mentioned before, you can have vitamin deficiencies. Not only can you have a deficiency of iron, but also vitamin D, calcium, and B12. These can be low. And if you're wondering why your vitamin D is low, you don't have a particular good reason. Or if you're wondering why your vitamin B12 is low and you don't have a good reason, it may be due to celiac disease. And lastly, you can have a skin rash. And the skin rash is particular where celiac disease is a really itchy rash on your elbows. It's red, itchy, and usually we can see if you have this, and this actually may be a symptom of celiac disease as well. These are a lot of the non-GI tract symptoms, which you actually may have as the most predominant symptom, and you actually may not have a lot of the gut issues that are associated with celiac disease. Now that we talked about what are the symptoms of celiac disease, if I am wondering if you have celiac, what do I do as a doctor to help diagnose it? Or if you are wondering if you have celiac, what can you ask your doctor to check to see if you actually have this autoimmune condition? And the first test that we can do is a blood test. It's a very simple blood test. Anyone can do it. It doesn't have to be a poop doctor. Even your primary care doctor or primary care physician or healthcare provider can check this blood testing. The best blood test that we have, the most specific blood test, is called the TTG, tissue transglutaminase. This is probably the best test that we have to see if you actually have this autoimmune condition called celiac disease. It's the most sensitive test that we have out there. It's a very good test to see if you have this. Now, the one caveat about doing this test is that you must be on a gluten-rich diet. What I mean by that is, if you think you have celiac disease or gluten sensitivity, you've already put yourself on a gluten-free diet or you've eliminated the gluten, this test will be falsely negative, meaning it'll come back as a normal test, and we may or may not know if you actually have celiac disease or not. And so in order to have an accurate blood testing, you must be on a gluten-rich diet for at least a few weeks to make sure we can accurately diagnose you with this autoimmune condition. Now, there are some genetic tests that can be done to help us to see maybe if you have celiac disease or not. These are not the best tests to capture if you have celiac, but what this test is very, very, very good for is to help us to rule out celiac disease. So what I mean by that is, if you get these genetic testing done and they come back as negative or normal, there is a 95 to 99% chance that you do not have celiac disease. Now, the other side of that coin is that if this test comes back positive, this actually may be a normal positive. It may not mean you have celiac, or it could mean you have celiac. So it's not a very good test to see if you have it, but it's a very, very excellent test to see if you don't have it. So in summary, the best test to see if you have it is called the TTG. You must be on a gluten-rich diet. The best test to see if you don't have celiac disease is the genetic testing. Now, once we've done the blood testing and it seems to confirm our suspicion, we actually have to see with the scope inside the small intestine and take biopsies to see if you actually have evidence of celiac disease or damage in your small intestine. The way we do this is with an upper endoscopy or an EGD. We put you to sleep, use a very small camera, go down to the small intestine. We actually take samples of the small intestine and look at it under the microscope to see if you actually have significant damage from celiac disease or not. The reason we do this is because just because the blood test is positive or high, that itself does not make a diagnosis of celiac disease. You have to have confirmation with a biopsy of your small intestine. And in that biopsy, we look for a couple different features to show that you actually have celiac disease, but also more importantly, allows us to grade the damage of your small intestine. We can see the actual damage. We can grade this on a scale to allow us to see how damaged is your small intestine and what we can do to hopefully prevent that damage from getting worse. So whenever we take a look, keep in mind our small intestine normally have these villi that are there. These villi normally absorb nutrients into the small intestine. Whenever you ingest celiac, you shear off those villi so they're gone, and so you cannot absorb those nutrients from the small intestine. And this is actually what we look at under the microscope. I have another video on how we actually do this as well. So coming up, I'm going to talk about the next couple of weeks, how do we actually treat celiac disease, but also probably the biggest question people ask me is how do we tell the difference between celiac and gluten sensitivity, which is a huge difference between one disease and the other. But in summary, celiac disease has GI symptoms, bloating, diarrhea, pain, maybe even constipation, but also more importantly, celiac disease has non-GI symptoms, anemia, depression, anxiety, maybe sores in the mouth, or even a skin rash. We have specific testing that we can do for celiac disease or whether you have this autoimmune condition, including both blood testing and also taking biopsies of your small intestine. My question for you guys, what questions do you guys have about what are some of the symptoms of celiac disease, or how do we diagnose it? Are there things in this video I haven't talked about? What have you learned from this video about how we help to diagnose celiac disease, and what symptoms can be from that? Comment down below. I would love to hear what you guys have to say. I want to thank you guys for joining me today. If you like these videos, I would encourage you to like my Facebook page. Every Tuesday around this time, I do a Facebook Live where I try to delve into one topic in depth to give you the information that you need. But also every Thursday, I do my Poop Tip Thursday, where I try to drop one poop bomb based on your questions to me about what I can do about your GI health. I want to thank you guys for joining me today. Click to subscribe to my videos. I always post these videos again on my YouTube page and my Instagram. I hope you guys have a great day, and I look forward to seeing you guys on future videos. Thanks and take care. I want to thank you guys for watching this video. Click here to learn more about celiac disease, and also click here to subscribe to more videos from me. Thanks and take care. All right, celiac disease, celiac disease, celiac disease. I need to say that slowly. Celiac disease. Whew, all right, let's do it. Let's get this party started. Let's get this thing taken care of.